Well, hi again. I'm here with you again. This is Dr. Ryan Sheehy, bringing to you some focused board review on antibiotics, and this time we're focused on fluoroquinolones and the combination of trimethoprim and sulfamethoxazole, or TMP SMX. Because this is focused board review, I thought it would be a good idea to just give you a single slide to walk through the details and the intricacies of the fluoroquinolones. Now, the fluoroquinolones act as topoisomerase 2 and 4 inhibitors, and they are listed over here at left, and they include the drugs moxifloxacin, ciprofloxacin, ofloxacin, enoxacin, gimifloxacin, and levofloxacin. So let's dive into the details of the fluoroquinolone drug class. Now, the mechanism of action of the fluoroquinolones is twofold. The mechanism includes action or inhibition of topoisomerase 2, which is often referred to as DNA gyrase, as well as an inhibition of topoisomerase 4. Something that I want to make you aware of is that the inhibition of topoisomerase 4 is the primary mechanism of antibacterial action against gram-positive bacteria. And it is the inhibition of topoisomerase 2, or DNA gyrase, that's the primary mechanism of action or antibacterial action in gram-negative bacteria. Looking at resistance to the fluoroquinolones, resistance occurs due to altered binding of topoisomerase, and this makes sense as topoisomerase is a main player in the antibacterial action of the fluoroquinolones, as well as increased efflux of the drug, which leads to a decreased intracellular concentration and decreased antibacterial action. Focusing on adverse effects, a majority of fluoroquinolones are well tolerated. Fluoroquinolones can alter the intestinal microbiome, which can lead to C. difficile-induced colitis. In addition, fluoroquinolones can also lead to Achilles tendon rupture, and this happens more frequently in patients that are over the age of 60. A unique adverse effect that relates to a single fluoroquinolone is that of moxifloxacin, and it inducing QT prolongation. Clinically, the fluoroquinolones do have quite a broad spectrum. The main focus is on gram-negatives, but fluoroquinolones do cover some gram-positives. I've listed some of the more clinically relevant coverage for the fluoroquinolones below, and this includes P. aeruginosa, E. coli, Legionella species, chlamydia species, and fluoroquinolones are a drug that you will see used in the treatment of urinary tract infections. So let's now begin our discussion of the second grouping of antibiotics in this video, and really the last grouping, and that is the combination of trimethoprim and sulfamethoxazole. Now you'll see this combination often referred to as TMP SMX, and the TMP refers to trimethoprim, and the SMX refers to sulfamethoxazole. Now trimethoprim itself is a benzylpyrimidine, whereas sulfamethoxazole is a sulfonamide. We'll discuss these drugs' distinct mechanisms of action on the next slide. As I mentioned, trimethoprim, or TMP, and sulfamethoxazole, or SMX, are often combined. And the reason why they are combined is because these drugs, mechanistically, inhibit steps in the tetrahydrofolate biosynthetic pathway, and they inhibit almost sequential steps. Now, TMP acts as an inhibitor of bacterial dihydrofolate reductase, and SMX acts as a competitive non-functional mimic of PABA. The blockade of these two processes within the tetrahydrofolate biosynthetic pathway are what allows trimethoprim and sulfamethoxazole to act and to have antibacterial action. Now, resistance develops to both of these drugs in unique ways. First, upregulation or mutation of dihydrofolate reductase is how resistance to TMP can evolve, whereas overproduction of PABA is a way to overcome sulfamethoxazole's action. And this makes sense because if sulfamethoxazole acts as a competitive non-functional mimic, if the bacteria can overwhelm the sulfamethoxazole with good PABA, then the tetrahydrofolate biosynthetic pathway can continue to function. The adverse effects for trimethoprim and sulfamethoxazole are listed here. You can see here that there are several adverse effects for trimethoprim, and these include anemia, leukopenia, and granulocytopenia. Now, these adverse effects with trimethoprim are due to trimethoprim's off-target antifolate effects and can actually be overcome in a patient with co-administration of leucovorin. Adverse effects for sulfamethoxazole include hypersensitivity reactions as well as photosensitivity. Now, since I'm talking about these drugs in combination, the clinical coverage that I'm talking about here on this last bullet include the combination of trimethoprim with sulfamethoxazole. There are instances that sulfamethoxazole is given by itself, but trimethoprim is always given in combination with sulfamethoxazole. So the coverage that I'm showing you here are the bacteria and the instances where the combination of TMP and SMX is used. The coverage includes such things as MRSA, treatments of urinary tract infections, as well as Shigella species, Salmonella species, S. pyogenes, and Viridans group Streptococcus. That wraps up our video and our time together. I hope you're able to take away some details and some good nuggets of information about both the fluoroquinolones as well as trimethoprim and sulfamethoxazole. Just to wrap up and to remind you, these are the different sources I used in this video. And please reach out to me on Twitter. I've got my Twitter handle down in the description of the video if you have any questions. Again, thanks for watching.